morning, ma'am. Dr. Ashok Agrawal from Army Hospital, Delhi. My study is the study of effect of occlusion therapy on macular vessel density in children with amblyopia on OCT angiography, a prospective observational study. The logic behind this: previous research has found morphological and functional alteration in the visual cortex and lateral geniculate nucleus of the amblyopia patients. The retina plays a role in the development of amblyopia is still debatable. Numerous studies have used optical coherence tomography to analyze macular structure characteristics, although the results are controversial. Recently, researchers have been able to investigate the retinal microvascular changes associated with human amblyopes using OCTA, a non-invasive neuroimaging modality. The design was patient diagnosed as a case of amblyopia based on BCVA by Snellen's chart and baseline investigation OCT angiography, stereopsis and contrast sensitivity and other anterior segment and posterior segment examination was done, and before occlusion therapy and after occlusion therapy the patient's follow-up visit was done at first, third, 6 and 12 months. Approvals: Institutional Ethics Committee of our Army Hospital Research and Referral. Inclusion criteria: newly diagnosed amblyopia cases presenting to the Pediatric Ophthalmology subunit. Age group was 6 to 14 years and patients who are willing for regular follow-up visit. Children who can maintain fixation on the spectralist OCT angiography machine will be included. Exclusion was the patient whose guardian refused or the decreased vision like congenital cataract, corneal scarring, opacities, retinal condition, maculopathies and cortical blindness. Patient with locomotor and cognitive impairments and children with nystagmus head noding will impair the image acquisition on the machine. Study design: the prospective longitudinal observational study conducted at a single center over a period of 1 year to study the effect of occlusion therapy of macular vessel density like SCP and DCP, and the other parameters were OCT angiography on Heidelberg spectralis and visual acuity by Snellen's chart, stereopsis by TN and Randot, and contrast sensitivity by Pellier-Robson. Methodology: consent was taken, taking visual acuity was measured, stereo acuity by TN and Randot test, dilated direct and indirect ophthalmoscopy of the fundus of the both eye using 20D lens, OCT of macula and OCT angiography of central 6 by 6 mm square of foveal avascular zone using spectralis domain OCT, Heidelberg spectralis, HRA plus OCT was done. Children diagnosed with amblyopia will receive full refractive correction followed by occlusion therapy. Duration of occlusion will be guided as per PEDIG studies, Pediatric Eye Disease Investigation Group. Each patient will be reviewed prior to occlusion therapy, first, third, 6th month and 12 months. OCTA principle, OCTA principle is to detect blood flow by analyzing difference in repeated scans of same area of tissue by repeated motion detection, separative moving and create 3D image. This is the image of OCTA. Results variables were the age group, mean age 9.07 and the age group was at less than 10-20 and greater than 10. Gender: female was 9, male 21, laterality or left right 16 and 14. Baseline mean age and BCVA was calculated. BCVA is log in the logmar. BCVA improved. Mean BCVA was 0.42 and at 1 month it improved to 0.12 and further initial improvement was within 3 months was better and faster, and after 3 months it was slower up to 12 months. The SCP across different time intervals, that was the mean SCP was 51.27. The mean increased to 53.83 and by the end of 12 months it was SCP reached to 54.20 plus minus 13.5. The comparison of deep capillary plexus was also made and it also improved, and DCP was 52.17 was initially that reached to 56.13. Conclusion: the study aimed to evaluate the effect of occlusion therapy on macular vessel density, and SCP and DCP was the main parameters were included, and the improvement in both SCP and DCP indicated the occlusion therapy not only improves visual function but also enhances the macular vessel density. Take home: the occlusion therapy is the gold standard treatment for amblyopia. The study underscores the effectiveness of occlusion therapy in enhancing macular vessel density and visual function in children with amblyopia. Additionally, improvements in visual acuity, stereopsis and contrast sensitivity were observed. Thank you. Fundus examination was done, the normal fundus examination and were included, sir. Perfusion was increased, foveal avascular zone also improved, sir. Circularity improved. On fundus examination, circularity you can observe improvement, sir.
Could you take studies beyond 12 months also?
Sir?
Are you like to take this study beyond 12 months also?
Sir, beyond 12 months, follow-up is very difficult, sir.
Because amblyopia you cannot stop at 12 months also.
No,
You
sir.
have to continue.
It has to be continue, and we have to reduce in the tapering manner. If we prescribe 6 hours patching for someone, then we have to reduce in the tapering manner to reduce the recurrence also.
Can you tell me one thing? Whenever the occlusion therapy is on, what
Sir.
actually you instruct the children to do during that time, and the one eye is patched?
One eye is patched, we active to do some doodling work and some active work and active studies like work, so he can engage his worse eye to do some work.
Something very interesting is that you should tell the children to do something which they are interested in.
Interested.
They're watching,
like
they're interested in watching
drawing
TV,
and
let them watch
drawing
TV.
and the interesting activities like
They're
that.
interested in even watching
Yes,
mobile
sir.
phone also, let
Yes,
them
sir.
watch
That
that videos.
for in this respect, the cam stimulators are also developed to increase the interest of the children.
Okay, thank you.
Sir. Sir, ma'am. मैम वैसे मतलब एक्चुअल आंसर इज बाय द ऑर्डर ऑफ गाइड. The previous studies was not so clear, so they have to find out the effects. Macular vessel density will increase, then in amblyopic children the vision will improve. Sir, VEP also, Hamurku and electrophysiological test was done. Hamurku and et al. Study was there. One study is before in the Japan or China.
Well, most of the things what we are seeing is that basically it's the choroidal thickness and the choroidal, means all these, if they are improving also it will be here.
Choroidal thickness
Yes.
also improved in before last study they have.
So was it correlating with your stereo or something like that? No, or was it just the vision?
Stereopsis also improved.
So do you mean that the macular vascular density improves, so the stereo improves? You don't know. Nice study, but we could do it much more.
Yes,
As sir said, we could extend the period and see what else is happening in the.
Because I am posted in the RR hospital, so there were some patients and parents also, they have transferred to their other units, so they cannot follow for a longer duration. 1 year is also very
So
difficult
what we
to
will
follow.
find, suppose now we say that the macrovascular density is improving and therefore the vision in those children improve more, kya? Like suppose we are doing the amblyopia therapy and we find like something.
Amblyopia therapy,
If we are doing
vision
a
improve.
paper, like we have to find what is the relevance of that paper, like basically. Good.